From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Vichy turns 30 today. That's right, 30 years ago today, the Sisters of Bon Secours created Bon Secours Health System. But the system's story really starts before 1983. Indeed, in the late 1960s. Back then, the Sisters of Bon Secours knew that they needed to strengthen their sense of mission and identity for their healthcare facilities to continue to succeed. So, in 1973, the chief executive officers of all Bon Secours facilities met for the first time. From this historic meeting, the Bon Secours Health Commission was formed to allow CEOs to share plans, problems, and opportunities, as well as consider the possibility of shared services. In 1978, a new corporation was formed, Bon Secours Health Care Corporation. The new corporation established priorities and criteria for financial performance, shared resources and personnel, and marketing and evaluation services. Fast forward to 1983, the Bon Secours Health System was formed with headquarters in Baltimore, Maryland. At that time, it operated 4 acute care facilities and 1 nursing home in Maryland, Virginia, Florida, Michigan, and Massachusetts. Back then, the sisters remained involved in the new health system and played strategic governance roles on the health system level, as well as serving as sister presidents of local system boards. Then, in 2003, in an historic and innovative move, the Sisters of Bon Secours created Bon Secours Ministries as a public juridic person. This public juridic person, Bon Secours Ministries, was to become the sponsor of Bon Secours Health System, enabling the sisters to share sponsorship of the health system with lay leaders. The Vatican approved the change in 2006, and on November 1st, 2006, the transition of sponsorship from the Sisters of Bon Secours to Bon Secours Ministries was completed. Today, Bon Secours Health System operates 19 acute care hospitals, 1 psychiatric hospital, 5 nursing care facilities, 4 assisted living facilities, 6 retirement communities/senior housing, 14 home care and hospice providers, and numerous other health services in 10 communities in 6 states: Florida, Kentucky, Maryland, New York, South Carolina, and Virginia. Please join us in celebration of 30 years as Bon Secours Health System, with a continuing tradition of being good help to those in need. In other news, we are working our way through the 8 values of Bon Secours: respect, justice, integrity, stewardship, innovation, compassion, growth, and quality. Today, our value is compassion. Bon Secours feels compassion means experiencing empathy with another's life situation. Compassion is being with another as well as doing for them. This being with allows persons to experience acceptance, concern, hopefulness, and sensitivity. Behavioral norms associated with compassion include: exhibit a positive, hopeful, supportive attitude which is sensitive to the burdens and suffering of others. Be with and empathize with those who suffer. Treat others as you would want a member of your family or yourself to be treated. Demonstrate care and concern in interactions with others. Accept the humanness of others, recognizing our interdependence. Put service to others above self-interest. Provide an environment, including systems and structures, which are sensitive to the needs of the people we serve. Provide or refer persons to supportive services that meet their spiritual, emotional, and physical needs. Compassion, just one of the values of Bon Secours. Finally, Bon Secours Medical Benefits Open Enrollment is here today, July 1st, 2013, and continues through July 19th, 2013. But don't let that time period fool you. Enroll at your earliest opportunity. And don't forget, enrollment this year is mandatory for all benefits-eligible employees, even if you had coverage this past year. Why? Because of the many changes that are taking place. So, look closely at the options before you enroll. If you're wondering where to get the information, here are a list of resources available today. First, there is the open enrollment packet that you should have received at home by now. If you did not receive it, please contact your local human resources representative, or better yet, call the Bon Secours Customer Support Center for your location. You can find your Customer Support Center number on the benefits page of IRIS. And speaking of the benefits page on IRIS, that is another resource for information, the benefits page. Check out the video of CEO Rich Statuto explaining why medical plan changes are needed. You will also find the quick links section on the benefits page. And don't forget the online decision guide. This is a very useful tool to help you make the best decisions on your choices for coverage. In the online decision guide, you'll find out about what's new, the 3 plan options. You'll meet the new medical plan administrator. You'll see options at a glance. 6 things to know about each option. There are also other tools like DocFind, Plan Comparison, a link to BSHGoodChoices.com, the ever-popular checklist for open enrollment, and many more important and helpful activities. So check out the online decision guide today on the benefits page of IRIS. Oh, and don't forget to enroll between now and July 19th, 2013. Bon Secours open enrollment is here. It's your choice. What will you choose? Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.